Nurses are fearless, caring, competent professionals. And we show up, we do what we need to do, and we put the best interest of our patients first. As change agents, we are powerful, really powerful. We have skills that we use in our clinical setting that we can leverage to make society a better place. Any big and revolutionary change that we need as a community is on the table. It can happen. And as a group, we can make it happen. Because I know that when nurses go to work, feel supported and love their job, that the best patient care happens. And I know that patients need us. But I think everybody has the opportunity to start now, to do something different, to make a different future for themselves that's better, brighter, more influential than it was before.
When opportunity knock, you don't send anyone to get it. Answer the door, welcome and let it in or regret it. They said if you can't beat them, you join them. I say forget it, because once you join them, you're building a ceiling the way you headed.
Welcome to Philadelphia. Philly is my adopted hometown, one I've come to admire. We have so much history. The country's first medical school was founded where I work, at the University of Pennsylvania. And Pennsylvania Hospital was the country's first hospital, co-founded by Benjamin Franklin. Yeah, Pennsy nurses, love it, okay. So Philadelphia has been called the birthplace of America. Independence Hall is just 6 blocks away from here. Inside that building, our country's founders performed what has been called a collective act of ethical visualization when they drafted the United States Constitution on the heels of the American Revolution. When I announced that starting now would be this year's AACN theme, I felt like I was signaling the start of our own revolution, a revolution of hope. Hope that we would crack open many of the fundamental principles of our current healthcare system because it needs to look so different from what we have now. And hope that we'd take our first steps down the road to repair broken pieces, to ruffle feathers, and to break new ground. It's time for us to carry out our own collective act of ethical visualization. It's time to frame a new constitution so we can define for ourselves and for others that everything we do as nurses is rooted in what's important for our patients and their families. Also important for our profession, but maybe most of all, in what's important for our well-being as individuals. Let me ask you something. Have you ever met someone new and gotten the look when you tell them you're a nurse? You know the look. It's that combination of, why would you ever do that? I don't know how you can, with, bless you and thank you for your service. I'm a pediatric burn nurse, so I get the look a lot. But what does this reaction from other people say about us? Does it mean we're heartless because we can handle the emotional challenges that come when we care for people some of the worst times of their lives? Does it mean we're not affected by their pain? Of course. We know that's not true, but those social reactions really used to bother me. Things changed for me when a colleague helped me change my mindset. They helped me realize that I can bear witness to devastating pain because I can see the end game. After caring for hundreds of children with burn injuries and their families, I know they can absolutely thrive, even though it means going through some hard stuff to get there. Changing my mindset meant I had to start with myself. And starting with ourselves is the first step each of us needs to take if we're going to frame a new constitution. Because when we harness the amazing power within each of us, we take control. Adam Grant is a brilliant organizational psychologist at Penn. He speaks, writes, does podcasts. He's all over social media, so you've probably seen his work. Adam says, thinking like a scientist involves more than just reacting with an open mind. It means being actively open-minded. It requires searching for reasons why we might be wrong, not for reasons why we must be right. and revising our views based on what we learn. What are lessons in that for us? We can try to approach life like a scientist. Nursing practice is based in science, so I don't think it's as difficult as it might seem. We can start by asking questions, stay curious and open to possibility, establish or reestablish trust within ourselves. And this is a tough one, be willing to be wrong. To approach life like a scientist, we might need to take a hard look in the mirror. We have to do it because we have an obligation to show up. First, we have to show up for ourselves. Then we have to show up for nursing, because each of us has a part to play. What part is that? What's your part? What's my part? It could be as simple and sometimes as complex as owning your own power. Here's another question. What do you think of when people say leader or leading or leadership? I have some good news. Being a leader does not mean it's time for you to become a manager, even a charge nurse. Leading can be something we step into naturally once we accept our own power. We may not even recognize the many forms of leadership each of us demonstrates every day. We listen, we support, we mentor, we advocate. We do it in person, in AACN's online communities, and in social media. You've probably heard of another kind of leading, and you might even be doing it yourself. It's called reluctant leading. Yeah. I was a reluctant leader once. I swore I'd never, ever be a manager. Then a burn unit I worked in was struggling to fill a manager position, and I felt an obligation to my colleagues. So after some introspection and talking with people I trusted, I interviewed and was offered the position. I figured, worst case scenario, if it doesn't work out, I'll go back to doing what I've been doing before and really loved. Those years were some of the most difficult in my career. But if I'm honest, they were also some of the most rewarding. It took me about a year to grow from reluctant to confident leader. Seeing what we accomplished as a team together energized me. It's when I first discovered I really could lead the way and shake up the status quo. One of the other lessons I learned was that nobody can lead alone. Reluctant leaders are competent, talented nurses with so much potential, but to thrive, we need others who believe in us. That's where a first follower comes in. Somebody brave enough to embrace another person's idea and create the momentum that brings others on board. Because following someone and helping others rise together is another way of leading. Have you ever done that without even realizing it? And if not, do you think you'd be brave enough to try it so the ball gets rolling? Imagine how supported and empowered your leaders, whether reluctant or enthusiastic, could be if they saw you following them in one of their revolutionary ideas for change. So much of what we've been talking about and living through lately involves change. Change is tough because as nurses, we love a really simple 3-step process to solve a problem. 1, 2, 3, it's fixed. Put some tape on it. It's funny, isn't it? Because as clinicians, we know people don't magically heal in 3 easy steps. Most change is incremental, one deliberate step after another. And sometimes the first step is the hardest. That's what we mean by starting now. Take that first step, knowing many more steps will need to follow. Let me give you an example of ruffling feathers from AACN's work on staffing. In this case, the steps we've already taken are definitely part of an incremental process, one where we'll need to be really vigilant about the end game because getting there won't be easy. For years, AACN has advocated boldly for appropriate staffing, but as we all know, things have gotten so much worse. With our eye on creating lasting and meaningful change in staffing, AACN convened a national task force to come up with solutions. We know the best solutions come when diverse voices are heard. So we intentionally invited both nurses and non-nurses, including people with some really different perspectives. As we wanted, a year later, we have a comprehensive framework of solutions that could be implemented starting now to address the staffing crisis. Yeah. Now, there were some passionate discussions and disagreements at times, but we finally gathered around priorities to put into action. Those priorities will be presented at a concurrent session tomorrow, so definitely check that out. The voices at the table made it clear that professional associations know the care setting best. They are the ones who need to set the standard for safe critical care. So that's what we are doing. My own research and the research of countless others confirms there is a point past which safe patient care just can't happen. We also know that minimally safe staffing is not good enough. Both our patients and nurses deserve better. Like the Constitution, I consider it an act of collective ethical visualization for us to produce an action-oriented and visionary template for the end game of solving the staffing crisis. This problem is decades old, and AACN has already taken some giant steps in the right direction. For example, establishing that appropriate staffing is a fundamental element of a healthy work environment. And, yeah, absolutely. And inviting our colleagues at ANA to join us in making staffing a priority advocacy issue and setting our own table to address it. And that is meaningful work. Yeah. What's also abundantly clear is that even when we achieve appropriate staffing, that's only one of the 6 pillars of a healthy work environment, or HWE as we like to call it. Without authentic leadership, skilled communication, true collaboration, effective decision-making, and meaningful recognition for nurses, we've only addressed part of the problem. We must focus on the whole of our work environment. So starting now, we're taking bold steps towards implementing AACN's HWE standards. One step will focus on implementing the standards in individual units. The other step focuses on them in hospitals. Nurses in the AACN Clinical Scene Investigator Academy have already been making changes that contribute to creating a healthy work environment. Have any of you been CSI nurses? Yeah, I see some hands. Change projects from that program have resulted in significantly improved outcomes such as reduced CLABSIs, CAUTIs, and falls, along with an estimated $84 million in hospital savings. Yeah, great job. This fall, AACN will start to roll out 60 nurse-driven CSI teams to develop change projects focused specifically on unit-based HWE standard implementation. Several months after that, we've envisioned a multi-site project that will connect 45 hospitals across the country to zero in on how the health of the work environment impacts the patient's journey across the continuum of care, including outcomes for patients, families, and the organization. I think Olympian Arthur Ashe said it well. Start where you are, use what you have, do what you can. In other words, start now. So where to next? I think this next step is another act of ethical visualization, only this one, each of us has to do for ourselves. What if each of us had a personal manifesto? We often use that word or when we talk about aspirations or rules proclaimed by a government or a political party. It's a proclamation, and an individual can frame one about what they stand for and how they intend to live their life. It would be a positive statement to inspire us as a compass that points towards what we believe is our true north. It would motivate us by focusing our mind and reminding us of our priorities. It would keep our behavior aligned with our values especially when things become stressful. Ours will become the foundation on which we build our professional life and a way of bringing into existence a new way of living. To show you what I have in mind, what if we experience an example right now? It could be something like this.
First and foremost, I prioritize my own well-being. I approach every part of my life with care and attention. I am guided by my values. I nurture supportive and inclusive relationships. I commit to invite others in and seek their diverse perspectives. I am responsible for my actions. I give credit to others for what they contribute. I am open-minded. I commit to using my voice and speak truth to power. I advocate, even when it means ruffling feathers. I embrace joy and leave room for magic that transforms me.
We just experienced what one nurse's personal manifesto could look like. And as they spoke, we saw their backup team taking shape. Fellow nurses, charge nurses, nurse educators, advanced practice nurses, students, colleagues from other professions, clinical leaders, nurse executives, and hospital executives. And backing them all up, AACN. Next year is NTI's 50th anniversary. Wow, yeah. What do we want our ancestors to say about us in another 50 years when they reflect on how critical care nurses took on one of the most difficult times, one of the greatest challenges in the history of healthcare? We are taking on a sturdy list of difficult obstacles, a major staffing crisis, losing the team we got used to working with, and work environments that are often short on fulfillment and joy. I've been quoted by several media outlets when I said, our healthcare system is being brought to its knees, because it is. We can either surrender to that narrative or we can start to change it, starting now. I choose to stay in nursing because I can visualize the end game. I know we will have to work our way through really difficult times to get there, but I firmly believe that our opportunity is now to create a healthcare system where we thrive, not just survive, where our patients get the care we know they need. We can't create the future we hope for until we can visualize it as individuals and as a collective of trusted professionals. This vision will be the blueprint that guides us. It's our declaration of what we value and believe about tomorrow. This vision is our Constitution. I invite you to join me in living it, starting now.